This project is about opioids and their effect on us all. What is an opioid? It is a class of natural semi-synthetic or synthetic drugs that include prescription medications and illegal drugs, such as heroin. Chemical compounds that are not derived from plant matter is also an opioid. It's a class of substances found in the opium poppy plant. It's a class of drugs used to treat moderate to severe pain. So we're talking about on a scale of 1 to 10, a 5 and up. It is a class of drugs that derive from or mimic natural substances found in the opium poppy plant. How do opioids affect the human body? Opioids bind to receptors in the brain and spinal cord. They work by reducing pain and inducing feelings of euphoria and relaxation. They affect the central nervous system with sedation and respiratory depression and addiction. They affect the gastrointestinal system with constipation, nausea, vomiting, and abdominal pain. They affect the cardiovascular with hypotension, which is low blood pressure, and bradycardia, which is a slowed heartbeat. So 90% of the world's opium comes from Afghanistan and is used for illicit purposes. In 2017, estimates were as high as 40.5 million people were dependent on opioids. According to the World Health Organization in 2021, about 60 million people had used opioids, with 39.5 million of those people living with drug use disorders. In 2017, it is estimated that 109,500 people died from opioid abuse. The United States of America consumes 80% of the world's opioids while only making up 4.4% of the world's population. So everybody popping perkies, definitely. American opioid use continues. So 3.8% of American adults abuse opioids. So that's over 10 million people. In 2021 to 2022, adults between the ages of 35 and 44 had the highest rates for opioid abuse. West Virginia also has the highest rates of opioid abuse in the U.S., largely due to high unemployment rates and just despair. Men are actually more likely to become addicted than women. People with a history of abuse, depression, neglect, and impulsivity are also more likely to become victims. Opioids can be classified into 4 categories. A, naturally occurring, which is the opium poppy plant from Afghanistan. B, they are synthesized from substances in opium. C, they are synthesized opioids. Or D, they are synthesized in the body. Endogenous opioids. So if you ever find yourself addicted to opioids, there is help that you can reach out for. So you can call 988. You can reach out to the following websites or call the Illinois Opioid Hotline. And they should be able to help you, point you in the right way. Okay. So we have pain treatment alternatives because opioids are extremely addictive. So sometimes you can use other things to treat your pain. And we have Jornavax. That's a non-opioid pill that can treat moderate to severe pain in adults. It carries no risk for addiction. The drug blocks sodium channels and pain receptors. It treats inflammatory pain after a surgery. And the side effects include itching, rash, and muscle spasms. Opioid facts continue. Opioids are the strongest painkillers. They are very effective at treating acute, severe pain. Opioids are not effective against chronic pain. Narcan nasal spray is the antidote to an opioid overdose. In narcotics and opioids can be swallowed, smoked, snuffed, or injected. Okay, long-term effects include heart infection, lung infection, infertility, increased risk of bone fractures, and sleep apnea.